This is my 326 final practicum, and I will begin by checking the doctor's orders. I would check for the accuracy of the and completeness of the order, making sure that everything is all set for the patient who I'm going to see today. I'm checking for allergies, and everything looks like it's appropriate and ready to start. So I'm going to enter my patient's room. Hi, I'm Anna. I'll be your nurse today. I'm going to start by providing hand hygiene. I'm going to ask you for your name and your birthday. Oh, great, that matches. Great. All right, so I'm going to provide privacy, and then I'm going to go ahead to tell you what I'll be doing today. So I'll be doing a trach cleaning and suctioning today, and also like just changing your wound, the dressing, okay? I'm going to start by asking if you have any allergies. No? Excellent. All right, so before I check your vitals, I'm going to raise the bed, pull the railing down, and I'm going to position you in a high Fowler's position, okay? Great. So, I'm going to, before I get started, once again, assess your vitals. And I'm going to just be auscultating your breath sounds, your lungs. Okay. So everything is good. I'm going to check, your respiration. And also I'm going to attach a pulse oximeter reading here, and which will remain here throughout the procedure just so I can monitor your oxygen levels and make sure you're stable, okay? Good. Your oxygen right now is 99, which is excellent. Great. All right, so I am going to now set the suction to 80 to 120, and I saw in your order that your oxygen is at 3 liters, and we need to bring it up to 5, okay, for this procedure. So I'm going to do that now. Good. So now I am going to start the procedure, but I'm going to get my wire ready here, and I'm also going to put a little drape over you. Make sure you're nice and dry. And I'm going to pour the saline to the cup. Yes. All right. So I'm going to put on my sterile field. I'm gonna get that ready. Okay. I'm just gonna place this here. And now I'm gonna get my sterile gloves and my other supplies, which are already here for me. All right, so I'm gonna make sure that I'm touching only the 1-inch border. The gloves are a little bit mixed up here, so okay, and then I'm going to go underneath. Okay, so I'm going to establish that this is my sterile hand and this will be my clean hand. Okay, now I'm going to get my suction thing. Which is sterile, by the way. to use my clean hand to attach the suction, and I'm going to go in. It's attached for video sake. I'm going to make sure that my hands are above my waist. I'm going to go in about 10 to 12 centimeters. So that's about right. I'm going to go in carefully. My hands are going to be straight. Okay, and then I'm going to come up in a circular motion while suctioning. Intermittent suctioning, by the way. I'm going to come here. I'm going to press. And we're going to do that twice, okay, Mr. Brown? And I'm going to make sure that your vitals are stable, which they are. And I'm going to go back in carefully. And I'm going to come up in a circular motion while intermittent suctioning again. Okay, so, and this entire time, by the way, his oxygen was being put on and off. All right, so right now, I am going to remove your in the cannula, okay? I'm going to use this hand, my clean hand, and then I'm going to use my sterile hand to take out the inner cannula. I'm going to put your oxygen back on, but I am going to assess and inspect the cannula to see if there's any abnormalities, and there really isn't, so you're good. I'm going to throw this in the garbage over there. So now we're going to take off my gloves, and we're going to remove your drape. This is garbage. And I'm going to take off my gloves, perform hand hygiene, and then we're going to proceed with your cleaning, okay? I mean, you're changing your dressing. All right, so this is all garbage. And how you feeling, okay? Great. You're still stable, which is excellent. All right, so now I'm going to, before I begin, hand hygiene. And typically 30 seconds is good. I'm going to pour the saline, new fresh saline, into the cup. And now I'm going to prepare my sterile field. I'm going to maintain my 1-inch border here. Making sure I'm not going over. All right, so my gloves here are kind of on the opposite side, but we're going to work with it. I'm going to put my hand inside here. Okay, so I'm going to maintain my hands at a sterile level. This will be my sterile hand. This will be my clean hand. I'm going to put a drape on you and making sure the shiny side is down. Of course, I'm maintaining the 1-inch border on this thing as well. I'm just going to drop it on you, okay? Right, so my hands are still sterile. And I'm going to take off the dressing and assess it with my clean hand. Yeah. Okay, so I don't see any color discoloration, any foul odor here. It seems to be, it's still good. Okay. I'm gonna throw this away. And then I'm going to use my Q-tips to clean around your stoma area, and I'm going to use my sterile hand to pick up my Q-tip, and I'm going to dip it in saline, and then I'm going to remove your oxygen, okay, for 10 seconds the most. And I'm going to go from one side to the other. Put your oxygen on, discard this garbage. And then I'm going to use my sterile hand again to go back into my sterile area. And I'm going to clean the other side, okay? I'm going to remove your oxygen one last time. I'm going to do the top. One swipe. And your inner cannula, I'm going to throw this away. Your inner cannula was already placed in. It was clicked in tightly. You just want to make sure you know that it's there, and it's secured, okay? So now I'm going to use the gauze, and I'm going to, my sterile hand is wet with saline, and I'm going to use my clean hand to move over the oxygen and just one swipe, and I'm gonna dip it in saline, squeeze, clean around, and now I'm going to pat you dry down, okay? Your vitals are still stable. Pulse ox is still 98, and I'm gonna just pat you dry, okay, Mr. Brown? All right. All right, so I am going to I'm going to put your 4x4 gauze on, your new one, your fresh dressing, okay? Okay, and now I can use both my hands to fix this. How you feeling? Okay. All right. So now I'm going to change your necktie. Is that okay? And first I'm just gonna unhook one side at a time. And while I unhook it, I'm going to put your, attach the other new one here. And bring it around, unhook the other piece here, discard of that. All right, and I'm gonna tie this around your neck. And I'm going to insert my fingers, 2 fingers, to make sure that it's in correctly and not too tight, okay? And it is in correctly and not too tight. Is that comfortable for you? Perfect. So now I'm gonna discard of this dirty towel, and I am going to assess your vitals one last time before I make an exit. All right.
You know what I realized when I was watching the video? My hands are
Okay, your vitals are good, and your respiration, I would do it for a minute, and right now it's really good, and your pulse ox is still at a normal range, 98. All right, so I'm gonna give you your call bell. I'm gonna take off my gloves. I'm gonna perform hand hygiene, and I already gave you your bell, right? And if you need anything else, Mr. Jones, just let me know. I'm going to put you back down to a comfortable level and put your rail up for safety. And I'm also going to position you back into a nice comfortable little position. All right, you comfortable? All right, so before I end here today, I'm going to document exactly what I did. I changed your dressing at 8 p.m. I gonna document my findings, which was your dressing. Old dressing was good. It was no signs of any foul odor or discoloration, and your stoma was perfectly healthy and is what it's supposed to be, which is normal. And that's it for today. So thank you very much.